Cardiopulmonary resuscitation, or CPR, is a vital skill that can save a life. The two key elements are pressing on the chest, which is called compressions, and providing breaths. Adult CPR is comprised of chest compressions, airway, and breathing. Quality CPR requires quick response and force, as these are considered the most important aspects. Compressing the chest circulates blood to the brain and heart. Chest compressions have the greatest significance for success and survival. Many rescuers fail to push hard or fast enough. Chest compressions should always be given at a rate of at least 100 compressions per minute. CPR always begins with compressions before administering breaths. Follow these steps when performing adult CPR. Place the victim on their back on a firm and flat surface. Remove or open up clothing at the neck and chest area. Feel for the end of the breastbone. Place the heel of one hand on the lower half of the breastbone and put the other hand on top of the first. Press straight down at least 2 inches and perform compressions. Let the chest recoil completely between compressions. Performing CPR is often tiring. Ask to switch positions when tired if another rescuer is available to help. Giving breaths during CPR can provide oxygen to the blood and brain. The preferred method is to use a mask. However, mouth-to-mouth can also be performed. A correctly executed breath will cause the victim's chest to rise. To open the victim's airway, put one hand on their forehead. Place your fingers on the bony part of their chin and gently tilt the head back while lifting the chin. To give breaths, hold their airway open as above and pinch their nose shut. Take a deep breath and seal your mouth around the victim's mouth. Blow into their mouth for 1 second and watch their chest rise. And repeat with a second breath. If the chest doesn't rise, reposition the airway. CPR, including giving breaths, is generally safe. If a mask is available, it should be used. The mask fits over the victim's mouth and nose. Follow these steps when using a mask to give breaths. Place the mask over the victim's mouth and nose. Open their airways by performing the head tilt chin lift maneuver. Ensure a good seal between the mask and their face. Give a breath over 1 second and watch the chest rise. Deliver a second breath. When the heart doesn't work properly, a victim may collapse. An AED can deliver shock to help restart the heart. These portable units have a computer that analyzes the heart rhythm and determines if a shock is needed. Follow the voiceovers and diagram instructions given by the AED. Apply the pads properly and let the computer determine if and when a shock is needed. Make sure no one is touching the victim if the AED advises you to push the shock button. An AED should only be used anytime a person collapses, fails to respond, or is only gasping or barely breathing. Follow the prompts in these steps. The first step is to retrieve an AED. These are often stationed in public buildings and are safe for anyone to use. Open it and turn it on. Expose the chest. Apply pads. Make sure no one is touching the victim if a shock is advised by the AED. Press the shock button when advised by the AED. Resume CPR immediately. Here's some information on calling EMS and 911. It is better to alert 911 immediately than to wait until you fully assess the situation. Make sure the scene is safe when approaching a victim. Tap and shout, "Are you okay?" If unresponsive, yell for help and send somebody to call 911 and get an AED. Stay on the phone until the 911 dispatchers tell you it's okay to hang up. Check their breathing. Begin CPR if barely breathing or only gasping. If the victim is breathing normally but not responding, roll them onto their side. This prevents choking on vomit. Let's put this all together. If the victim is unresponsive and gasping, or not breathing, you must give CPR. Use the following steps when giving CPR to an adult. Make sure the scene and area around the adult is safe. Tap and shout, "Are you okay?" Yell for help. You may need to call 911 and get an AED. Check breathing. If the victim is not responding, breathing, or is only gasping, start CPR. Give 30 compressions. Open the airway and give 2 breaths. Continue to give compressions and breaths until the AED arrives, more advanced help arrives, and the person begins to respond. Choking is a preventable cause of death that occurs when food or another object becomes stuck in the throat. The airway becomes blocked and immediate action is needed. The victim typically only has a few minutes before they pass out. The universal sign of choking consists of holding the neck with one or both hands. Here is the chart, which is also in your manual, for choking. Feel free to study this. For relief of choking, perform the Heimlich maneuver. The Heimlich maneuver is used on adolescents and adults. Follow these steps. Stand behind the victim and wrap your arms around their waist under their rib cage. Put your fist above the victim's navel in the middle of their belly. With your other hand, hold the first fist and press forcefully into the abdomen and toward their chest. Continue performing thrusts until the obstruction is relieved or the victim becomes unresponsive. That concludes the CPR and AED for adults lesson.